Okay, so the next skill that I'm going to show you guys is how to provide peri care to an incontinent resident. Okay, you're going to run into this, okay, so just be prepared for it. Being incontinent means that the patient just can't hold their bowels in anymore and their pee, so they're just pretty much urinating on themselves, okay? So you want to make sure you have gloves for this skill, okay? And the number for linens to from washcloths to towels is 41. So 4 washcloths, 1 towel, okay? So here we go. We're going to go ahead and knock in, knock, knock, knock. Good morning, Mrs. Jones. How are we doing today? She's going to reply back that she's doing fine, but she thinks that she may have went to the bathroom on herself, so we're just going to go ahead and clean her up. So Mrs. Jones, my name is Michael, and I'm going to be your CNA today, and we're just going to go ahead and clean you up a little bit, okay? We're going to provide some peri care for you, all right? And she says that that's fine. And you can say that we're just going to clean you up a little bit, okay, or peri care, because a lot of times maybe the patients don't know what peri care means, okay? So you're going to go ahead and close the curtain for patient's privacy. You're going to go ahead and perform hand hygiene, and you're going to get your chucks. This is going to be your clean barrier. Okay, that's going to allow you to place all of your supplies on. So first we're going to go ahead and get our linens. Okay. So 41, so 4 washcloths, 1, 2, 3, and 4, and 1 towel. Okay. So 41. Now I'm going to need soap for this, okay? Now, you are not going to need lotion for this skill, so just remember that, okay? No lotion. So we're just going to go ahead and get our pair of gloves here. Okay, so I've got my pair of gloves. I'm going to go ahead and get my basin. Okay. I'm going to go ahead and get my lukewarm water here. Okay, fill it up about halfway. I have to test it, and then the patient has to test it, always. Okay, so Mrs. Jones, we're just going to go ahead and have you test it. Okay, so she tests it. She says that it's fine. Okay, and don't forget with this skill, you're also going to need 3 chucks, okay? So for you, 3 chucks, okay? 1 that is going to be placed as a barrier, and then 2 brand new ones for your patient, okay? 1 that you're going to change her on, and you're going to provide peri care. So this one will get wet, okay? You're going to change out the first urinated on one. This one is going to be for the peri care. This is going to get wet. And then this is the last one you put her on. You're going to put her on a dry chuck. Okay? You're going to leave your patient on a dry chuck. So, now that we've got that all squared away, you're going to go ahead and put your washcloths in the water. Okay? And you're going to don your gloves. Alright? Now sometimes it's easier. Just get the bigger gloves, especially when you're testing. Some people get nervous and can't seem to fit into gloves that they thought that they could fit into, so it's okay. Alright, just locate those ahead of time. Alright, so here we go. So we got our gloves on, so we're now going to go ahead and go under, okay? And we're going to go ahead and rotate our patient first, okay? So we're going to put them on their side so we can roll the chuck up underneath and tuck it underneath their body to get it out, okay? So, neck and knees when you're going to go ahead and rotate your mannequin on the count of 3. 1, 2, and 3. Okay, keeping your patient privacy to a maximum as much as you can. Okay. And now we're just going to roll this just like making an occupied bed. So if you want to go back and check that video, okay, this is exactly how it's done, just with a sheet instead of the chucks. Okay. So now, the second chucks, we're just going to roll it up. Okay. Make it easy on yourself, cotton facing you. Okay. And then you're just going to tuck underneath your patient. Now what I recommend is tucking this as far as you can get it to the other side, okay, of your patient. Alright, so now I'm going to go ahead and roll my patient back. Okay, so again, neck and knees. So 1, 2, and 3. Make sure that you are counting. Right. makes it a lot easier, and you're also bracing the patient for movement. Okay. All right. So you're not going to expose your patient too much like this, but I'm just doing this to show you guys. This is what it's going to look like. You're going to have the urinated chuck that you can just roll up. Okay. You're going to discard this in the trash. Okay, so that's just in the garbage there. Okay. This brand new chuck is going to come out. Okay. And you're now good to go with cleaning your patient. Okay. So, what I always like to do when doing this skill, okay, is you're going to bring the covers down, okay, the gown up. Okay, to about the top here. All right, and then you're going to ask Mrs. Jones if she can just open her legs. Okay, so her legs are open, and you want to close off as much of this area as possible. Okay, you just want to leave kind of a little square that you can work in. Okay, so first thing I got to do is I got to soap it, then rinse it, then dry the area. Okay, now for this skill, okay, peeling the surfaces is a must. You have to do that. Okay, so if you have to, use your hand as a guide. Okay, so 5 swipes, and if you use your hand, that's exactly the guide that you're going to need. Okay, so we're going 1, which is the inner thigh, and peel that back so we have a clean side. Okay, number 2 is going to be the left vaginal area, and peel back. 3, down the center meatus, and peel back. 4, and then number 5 is going to be the thigh or groin area. So that's soap. Now we got to rinse. And you're repeating the exact same step you just did. Okay? So you're just rinsing. So left vaginal area, down the center. Okay? Right vaginal area, and then the thigh or groin area. Okay? So you have your towel. So you're just going to go ahead and pat dry. Okay? And now, let's get to a clean side. Patient safety and, preventing infection, that's always paramount. Okay? So now what we're going to do is we're going to go ahead and close her legs. Okay? We're now going to pull the gown down, sheet up. Okay? And now we're going to go ahead and roll her. Okay, so we can do her backside. So neck and knees, 1, 2, and 3. You want to brace your patient for the moving or rolling process. Okay. Okay, so your patient will be on the chucks just like that, okay? So now, what I recommend is, again, using your hand as that template, and 1, 2, 3 down the center, 4, and 5. So you're going to soap it, rinse it, and dry it. Okay, so we're just going to soap it. And remember, you're wiping up. Okay, that is 1, 2 is the inner buttock, 3 is the center, 4 is the inner buttock, and 5 is the outer. Okay, so that was soap. Just have to rinse. And again, repeating the exact same thing you just did. 1, 2, 3 is down the center, 4, and 5. So you guys are almost done. So now we have a clean side on this towel. So we're just going to go ahead and pat. Okay? Notice you're going away from the vaginal area, so that way you keep everything clean. Okay? And you're not inducing infection. Okay? So now, think of it as the first part where we had our patient, okay, that was on a urinated chuck, and now this is wet, not by urine, but just by you trying to perform peri care. So we're just going to go ahead and roll this up, and you're going to interchange it out just like you did the first one. Okay. These more detailed skills, a lot of them are just copying exactly what you just did. So don't get too freaked out and say, oh man, this is going to be a much longer skill and I'm going to have a hard time with it. You won't, because you'll see that all the skills run together pretty much. Okay? So now we're going to go neck and knees to flip Ms. Jones back over, count her out, 1, 2, and 3. All right. And again, you should have went far enough to where you have the old chuck, which just has water on it, and probably some soap just from you cleaning. So you will discard that chucks, and then you're just going to roll out your nice dry one. Okay. Making sure that your patient is comfortable. Okay, that looks pretty decent. All right. Next, we have to clean up our supplies. Okay. So we're now going to come here again. For the evaluators, they're going to want to see you wipe this out, or rather rinse it twice. I like to do it 3 times just to be extra clean. Get my paper towel and make sure that this is dry. You never want to put this back wet. And now my chucks. This is going to be discarded in the trash just like the others. Okay. And now my gloves. Gloves to be taken off, okay, from the palm downward towards the floor, okay? And then that second glove is going to go completely around the first one. Take your 2 fingers by the wrist and go ahead and pull right out. Makes almost like a little baggie for your gloves, okay? So next, we're going to make sure that Mrs. Jones is comfortable. She is. We're going to go ahead and give her the call light. Again, you're just going to give it to her hand. Okay. You're just going to cover her back up. Mrs. Jones, is there anything else I can do for you? She says, no, thank you. All right, I'll see you in a little bit. Open the curtain. Perform hand hygiene. Look at your patient. Make sure that the skill is correct, that you did everything. Tell the evaluator, I'm done with this skill.